Taking care of our skin, it's an important part of our well-being. How well do you know how to maintain those healthy skin do's or don'ts for improving your skin's health and improving the appearance too? In addition to wearing sunscreen, there are other steps that we should be taking as well to maintain our skin health. So Dr. Claire Dillingham with Cone Health Plastic Surgery Specialist is here to help break it down for us. All right, so first and foremost, let's kind of start with the basics. Just how important is establishing a skin care routine?
It's very important because if we don't have a routine, we're probably not going to stick to it. And the better we take care of our skin as we're aging, the better our skin will look as we get older. And not only will it look better, but we have to remember that good-looking skin is usually healthy-looking skin.
Okay, so let's kind of do the common mistakes that people make and some don'ts that we kind of need to be aware of.
I think the biggest one is we get tired, we have a lot going on, and we don't wash our face before we go to bed. That's the biggest thing, because it's not just the oils of our skin, the makeup, but the pollutants from the day. So it's really important that you use a good skin cleanser, even if you don't do anything else. But I also think of the evening as it's sort of a free time for the ability to put something on your face that may turn back the time of aging just a little bit. So that routine is really important for really keeping your skin healthy.
Okay, so let's kind of go through like the routine, especially in the morning too. In the mornings, what order should we put on our skincare products? Makeup, sunscreen, moisturizer, all that?
Oh, that's a great question because it can get confusing. So one way to think about it is you always have to moisturize your skin. So moisturizer goes on first. Then the sunblock goes on. Now, some sunblocks have moisturizer in it, so you could think of that as the first step. But moisturize, get a good base that's not going to dry out, because if it dries out, it's going to crack. And if you crack when you have your makeup on, then it's just not going to stay on as well. So you moisturize, you sunblock, and then you can put your makeup on. If you're not adding other things, that's a whole nother story that we can talk about too, when you're adding those elements for trying to decrease the time of aging with like the ZO products, where there are a lot of really good products that help with the pigment, and I think we're going to get to that, so I'll hold.
In between each one, like the moisturizer, the skin, the sunblock, and the makeup, do we need to wait like a minute, or just until we don't feel like it's feeling tacky, or it doesn't matter?
Great question, just till it dries.
Okay, gotcha. All right, so at the end of the day, we kind of touched on this a little bit. What's the order that we should be following for cleansing our face using moisturizer, etc.? You said at least use a cleanser.
At least the cleanser. But if you're on a routine, the routine, whichever it is going to tell you, like the ZO routine, will give you a good step-by-step process. But in general, you want to clean the skin. And then you want to, if you're going to use a toner or an exfoliant, you can use that, and then moisturize. And then if you're going to use some of the products that help with the pigment and the damage, then those would go on.
Like a retinol or something of that nature?
Yes, yes.
Okay, so what about facials? Because a lot of people get them and then other people have never had them before. So in addition to our daily routine, what role does a facial have in maintaining healthy skin?
Facials are great, especially when you have them done by an esthetician, because they'll pull in this nice big microscope and really get down to the nitty-gritty of some of the clogged pores that we can't see, even with our 10 plus little mirrors. We probably don't see them because we can't get to each angle of our face. So the facials can be really helpful in helping to keep the pores from really clogging up. And that can lead to sebaceous gland hyperplasia, which is basically where you see the big pores in people that aren't really desirable. That really helps.
Okay, so how often should we be getting a facial?
You can get a facial as often as once a month.
Okay, so no more than once a month?
Probably not.
Okay. Is for the best benefit, is it something where you need one like every 3 months though to really keep up?
Yes, that's a great point. Every 3 months is a really good time frame for because that's sort of the repetition of how your skin sloughs and regenerates. So that's a great time period.
Okay. How about any concerns about people trying like a facial at home or a mask or something of that nature?
Oh, that's a good one. That's a question we get asked a lot. So there are some okay products for home. The thing to keep in mind though is that if you're buying something over the counter, you're not buying it prescription strength. So it may not harm, but it may not help. And so if you can get the supplies from your dermatologist, from your plastic surgeon, you're going to get a better quality for any downtime that you might have after the facial. So it is possible. You just have to be careful that you're using a product that's really tried and true for what it says. Otherwise, you're just using money on a nice moisturizer.
So there can be a lot of irritants around summertime. You got the heat, you got the humidity, you got the sand, you got the sun. So what steps should we consider to help prevent or soothe our skin from all of that?
Your moisturizer is really good, and then really getting on that, we're back to that skincare regimen, which is really important to calm down the irritants from the day. And the Sente and the Zeo are really good. For example, the Sente is a really good one that helps with the pigment that you get from the sun. Even when you wear your sunblock, you're still going to get some pigment, especially if you're colored like you and I are. We look at it and we're going to get a burn. That really helps with the pigment, and the pigment leads to those dark raised spots called your seborrheic keratosis that are really hard to get rid of once you get them.
Does it matter if you wash your face with hot or cold water or warm or cold water?
Warmer water is going to be better for opening up your pores.
Oh, okay. All right. So we mentioned facials a little bit earlier. What are some other options for healthy skin that people maybe might not have thought about before, but should?
Well, Tanya, let me show you this, because this is a really interesting picture. Here is a daughter and her mother, and you can see the aging process that's taken place. And so in this picture, you can see where we've got nice fullness in the cheeks. We have very little wrinkling, very little hyperpigmentation. So filler in this area would do really well and take away that drawn down, tired look. Pigment in this, or Botox in this area would do really well. And then laser. So with that pigment, I'll tell you about laser, because that's probably one of my favorite things because it's so effective. There are a couple of different kinds, and it's based on sort of the depth that you're wanting to get to. So if you're wanting to get to the pigment, there's very little downtime, maybe, a few hours where you're a little bit red, but several consecutive treatments about a month apart, and you can see some remarkable difference in the pigment. And then you can go with some deeper lasers, and it's based on the wavelength, and those you're going to have a little more downtime, like 4 or 5 days, but you're going to get collagen stimulation, which is going to help with the wrinkling and the jowls. It's just amazing to see.
Okay, so you can use lasers instead of like getting a facelift.
There is nothing that is as wow as a facelift. However, the facelift time, you're talking about 2 weeks downtime, the risk of the surgery, the cost of the surgery. So there's nothing that really replaces the full effect of a facelift. But if you do some of the lasers and the skincare regimen, you may not need a facelift.
Okay. Are there some common misconceptions about these kinds of options that you'd like to set straight?
I think the biggest one is the danger of it. If you're doing it at a reputable office with board certified physicians who know the equipment, then you're in safe hands, because the downside to the lasers is really burn and pigment problems. So you have to be careful with that. Once in a while, we'll do a test dose for some of the patients who have the darker skin types to make sure that it doesn't cause darkening of the skin or lightening of the skin. So it could go either way. But I think that's probably the biggest one. The other is people fear the pain of it. But with a cream that we put on, I'm a wimp and I can do it.
Okay, we have about like 45 seconds. If someone has questions about how to improve their skin health, what do they do? Where do they go for that?
So we're located on Church Street. We're with Cone Health, plastic surgery specialists. We have physician assistants. We have a wonderful esthetician, really just a fabulous team. I have a partner, Dr. Taylor, and as a group, we really enjoy seeing patients and really helping them meet their goals for healthy skin and good looking skin, and they go hand in hand.
Well, thank you so much for your time and your expertise in answering those questions about the routines that we should do, especially in the morning and night. If you missed any of this, this is going to be in the To Your Wellbeing section of our website.